Hello, hello everyone. I'm Yves Nsavyimana, medical student at University of Burundi and intern at the University Teaching Hospital of Kamenge in Burundi. I'm so happy to be with you, and I'm presenting. I'm a main author of this abstract of the project research. The name of the abstract is the name of the research is knowledge, attitudes, and practices of medical students on COVID-19 in Burundi. So let me begin. So about background, COVID-19 first appeared in China in late 2019 and was declared pandemic by the WHO in early 2020. The first case in Burundi were reported in late March 2020. Our study aimed to find out the basic knowledge, attitudes, and practices on COVID-19 of medical students who have already started their hospital practices, likely to encounter patients since they were trained before the start of their internship. So about the method, we collected data both on pre-discharge questionnaire and an online survey via a Google form, and we analyzed socio-demographic data as well as knowledge, attitudes, and practices of COVID-19. We used random sampling method. As software, we used APM4 for data analysis. For results, out of the three universities with medical faculties in the whole country, we were able to collect responses from 78 students. 50% were from the University of Gozi, 46.15 were from the University of Burundi, and others from the Hope Africa University. Males were represented at 69.23%. Only 34.62% of our respondents claim to have received training on COVID-19. If not, all of them claim to have learned it from various sources as social media, Google, public or electronic poster, and online course. In general, the majority of the students had advanced knowledge on COVID-19. 78.21% had full knowledge of the means of propagation. Only 21% knew more about the risk of complications. 64% claimed to follow the preventive practices against COVID-19, while almost 41% washed hands less than 1 ounce an hour. In 49% of cases, the students stated that they throw away the mask in the garbage of after use. Knowledge, attitude, and practices didn't depend on the university. A significant majority of students, as 87.2%, indicated they were scared of being infected by COVID-19 during the internship. About conclusion, medical students in Burundi have advanced knowledge regarding COVID-19, but still lack some necessary and useful information to counter the spread of the diseases and the risk of complication. Also, self-information takes precedence over training as a source of information. It will be important to teach medical students about COVID-19 and how to prevent themselves before starting their internship. To teach them how to use the personal protective equipment and to give them necessary tools which can help to prevent themselves to COVID-19 during their clinical study or internship. Thank you so much, everyone.